So what do we know? We know that we need new strategies for this battle. How can we have a bigger impact on biofilm? And in working together and creating this product and really trying to create tools that can help dentists and hygienists and patients know how to use these products, we reviewed more than 350 scientific studies about what agents are the most effective at helping control the bacterial load in the mouth. And I recently was able to listen to Dr. Samuel Lowe, who's a renowned periodontist and a lecturer. He presented a lecture at the AOSH, so the American Academy of Oral Systemic Health scientific review meeting. And when he asked what mouthwash or products we should be using instead of chlorhexidine, he said essential oils. And when he said that, I was super excited to hear it because I already knew that we were in development of this incredible new product line. So it was really exciting to me. But there's been a lot of other studies too proving the value of mouthwashes in controlling oral biofilms. Here's one from the Clinical of Microbiology and Infection in 2007. They published a study showing that mouthwashes that have active antimicrobial agents are really, really beneficial at helping us control biofilm in the mouth. So that's really exciting. We've got a whole host of other studies that I think are important for them to know. When we look at herbal mouth rinses compared with essential oils and chlorhexidine mouth rinse, there's a study published in the Journal of the American Dental Association in 2008, and they studied all three. How did the herbal mouth rinse perform compared with the essential oil mouth rinse, and how did it compare with the chlorhexidine mouth rinse? And the results are really mind-blowing. The essential oils rinse far outperformed the others. It inhibited the growth of most of the 40 test species, significantly lower MICs. You want to just share for a quick minute, those who aren't very familiar with scientific terminology, what that even means?
So, long story short, when you're looking for a gold standard of any product, you want to reduce the amount of those types of microbes that are going to have a negative effect on tissue, negative effect on the teeth, negative effect in the body in general. So you want to have this minimum inhibitory concentration. You want to be able to drop the amount of pathogens to a level that the body can control in and of its own efforts. And certain types of bacteria, certain types of species are not only resistant to really strong and tough antimicrobials, whether we're talking about antibiotics, whether we're talking about things that are more toxic in general, like you're talking about kind of the phenol groups, more like or things like alcohols or whatever, they have an ability to be resistant. What we're talking about is the ability to lower the effective pathogenicity or the meanness of those bugs in their ability to cause damage, allowing the body to kind of do what it does best. And so what I love that you're talking about so passionately is out of all of these studies, think about that, over 350 studies looking at different options, looking at effectiveness of things that we use that we consider gold standards. And in the end, what we have found is that nature solved it for us. Nature actually knows what it needs to do to take care of itself. So we don't really need to go out and reinvent that. We simply need to study those, bring them in so that they're safe, bring them into a product so that it's potent, effective, and that's really what we're talking about here.
Absolutely, and I love that. So thank you for helping explain some of that, because again, I've had the advantage of really studying these research papers and have learned an incredible amount through that journey. Another study that I found was really fascinating was published in Dentistry Today, and they were looking at how the overuse of antibiotics in dentistry has created some of what you're talking about, these strains of superbacteria. And what's awesome is that these microorganisms do not appear to be able to develop tolerance or resistance to essential oils.
So one of the problems that we have in oral health care is the fact that the only option that most of us have is to overprescribe, meaning as soon as we realize that a specific thing that we're using, that's the traditional gold standard, is not being effective, we have two options. We tend to switch to another antimicrobial product, or we simply increase the dosage of what we've already been using. And really what we're doing is we're creating that downward effect, or that same circle of overuse, and the pathogenicity then becomes more virulent. They become more aggressive over time. So what we really need to find is something that's safe, potent, effective in a smaller dosing method that the individual can use on their own and that can use across multiple age ranges and the health of the individual.
I love that. And so knowing that the bacteria that we're trying to have an impact can't develop tolerance or resistance to essential oils is really key. And that's one of the reasons why the research took us in that direction. So we also look at another study that was published in Dentistry Today, and this was about how at-home use of essential oils-based products is shown to significantly reduce bacterial counts. And what's awesome is it didn't just reduce the bacterial counts, but there was less bleeding, significant improvement in tissue health, and patients actually reporting that their mouths felt significantly better. So here we have products that are actually getting us the results that we want for our patients, and patients are actually able to recognize those results on their own.
And there's two reasons for that. What's brilliant about these essential oil compounds is think about it this way. A lot of products that we've used in the past, they're designed and targeted to reduce the amount of those active crummy bugs, right? So we're wiping those concentrations out to a degree. But that product that we've used to reduce the bugs or the bacteria, in and of itself, it's not designed to increase the health of the tissue, meaning it's not inducing new cell growth. It's only wiping out a specific species of bacteria. What's amazing about essential oil chemistry is that it works in multiple areas. So not only is it reducing the concentration of bacteria, for instance, but it's also stimulating growth of new healthy cells. So we're achieving both results at the same time, which is, to me, I think, especially as a chemist, I love that. You're getting multiple functionality from the same product.
Right. And that's what's super exciting, is knowing that we've taken all this research proving the value of essential oils, and we finally have a product that we can share with patients that can make a difference in their health and in their lives.
Mm-hmm.